We have a wonderful speaker to lead us off. Paul Schmitz, his bio is on the tables. I'm not going to read through his whole bio, so I want to cut into his time. But he's an author, a leader, a visionary in this whole field of collective impact. He was there and was part of the beginning of creating it. So he's seen collective impact, this model, from its inception and how it's grown, how people have applied it all around the country. You know, he talks to people doing these kinds of collaboratives in all sorts of fields, education and housing, and but also in substance use. Has been at SAMHSA meetings and regional and local meetings on substance use. We were just talking in the car on the way over. That's kind of, he's been doing some of those lately. So he's very well versed in it. And I asked him to please, talk with us today about collective impact amid collective uncertainty, and how do we start to approach things, and what can we learn, and how can we do this? So with that, I'll bring up Paul.
Good morning, everyone. So what I'd like to do to start is, if everyone could stand just for a moment. I'm going to count to 3. And at 3, what I'd like you to do is express how you're feeling about managing in the current context, socio-political context we're in. And I'd like you to express that either with a sound or a gesture, but however you want to express how you feel about managing in this current context. On 3. 1, 2, 3. All right. So take a deep breath. What I'm gonna share today is, I've worked with a lot of, you can all sit down. In the brief time that we have, what I want to share is just some lessons we've been learning working with groups around how to manage in this current environment. And so the first thing I want to talk about is this idea called the Stockdale paradox. It was first in a book called Good to Great by Jim Collins, who's from Colorado, many years ago. And the basic idea was that he was a prisoner of war in Vietnam. And he said that those prisoners of war who every day thought, today's the day I'm going to get out, died of a broken heart. He said those who from the beginning thought they were doomed and never were going to get out, died of despair. He said the ones who made it were able to hold 2 competing thoughts. One, that they had absolute belief that they would prevail, and they confronted the brutal facts of their reality and didn't shortchange it. And I feel like in this environment, holding that tension is a key part of leadership for all of us, especially if we have teams we manage and others, is how do we both hold the brutal facts of our reality and hold ultimate faith and hope that will prevail. And I think that's key to this moment as leaders. The second thing I want to share is that a lot of the challenges that groups are facing are collective action problems. And if I take an example from the news of universities, one by one, they were being picked off to do these settlements. And then finally, a number of them started coming together and saying no. And once people started doing that, it's this thing that every organization, if you think your role right now, if you're being affected or impacted by a policy that's at a federal level or something, if you think your job is to just manage it for your own organization and you're not thinking about how do we collectively address these things, that's where it gets hard. And as leaders in organizations doing this work in this environment, we have to think collectively to thrive. We can't only think about our own effort. Just briefly, collective impact, we like to say it's a set of practices. It's effectively answering the question of how do you move population and systems change? And it's an understanding that it takes a set of practices that groups use together. And those practices can be different. But the aim is how to organize a coalition that works together to move some population or systems change, whether it's reducing misuse or deaths from opioids, or whether it's increasing grade level reading or reducing infant mortality, but that there's a North Star population level change they're trying to move. In 14 years now of doing this work, the big lessons have been that the clearer and more concrete the strategies, the more effective both the coalition is in holding together and the more effective they are at moving it. That when groups have vague or aspirational goals, we find they tend to fall apart. But, you know, to use an example, if I was visiting two communities and one said, we're trying to move grade level reading from 60 to 80%, that's about 300 kids a year. And those 300 kids are primarily in 18 elementary schools, and this is how we're working in them. And another community said, we believe all kids should succeed in reading, and we're doing a universal program to get everybody. There's no question which one I'd bet on. One has a clear strategy, has used data, has figured out how to really target and focus on moving the needle. And the other is just going to do a lot of good work, probably what they're doing now. The reason a lot of us came to Collective Impact, the way I came in was in 2010, the headline of my local newspaper in the morning, I live in Milwaukee, Wisconsin, was we had the worst reading scores for African-American children in America. That afternoon, I got a newsletter from the largest youth-serving organization in the city boasting about all the outcomes it was achieving with the 15,000 children they serve. And the disconnect hit me. How can we have so many amazing groups achieving all these outcomes, and yet when we add it all up, we still have a terrible result? And what Collective Impact says is rather than hope that if everyone does good work, it all adds up, let's actually build a strategy aimed at the result and figure out what everyone has to do differently and together in order to meet that. And so that's what we mean by a clear strategy. The second idea is just the form follows the function. I was sharing with Jose and Robert earlier that, you know, I worked with a rural collective impact focused on mental health in 4 rural counties that had a half-time FTE backboning it. I've worked in a large urban school district on a collective impact that was working across 7 fields of work with a 26 staff backbone. The form of the collective is going to be dictated by the function, by the strategy and goals it's trying to reach, by the community it's in. And so for us, the form has to follow the function. A lot of people come to us and say, I think I'm doing collective impact right. We're doing this, 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 and this. And I'm like, we actually don't care how you do it. What we care about is, are you moving the needle? And are you organizing these practices in the best way to move the needle you're trying to move? And so we have much less concern with fidelity to a process than we do with fidelity to the result you're trying to move. And finally, culture eats strategy for breakfast. It's a famous Peter Drucker quote, but basically the idea is that you can do all this, but if you don't build trust, if you don't have inclusion, if you don't have equity in your agenda, if you don't have the things that hold a group together to do difficult work, it's not going to work. And so for us, these are the 3 lessons we carry forward that kind of drive how we think about supporting collective impact. But I'm going to move to talking about some things that we've done this year with groups to think about managing this work, this collective work in the current environment. And the first, I wrote a piece in January on reckoning with the election and recommendations for groups. And I still think most of them hold, not all of them, as you'll see. But one was the notion that at that time, people were saying, geez, look, this is a landslide. And I was like, it was won on the margins. And so as we think about our country, I live in Wisconsin, where it was won by like 5,000 votes. And so just recognizing that there wasn't a landslide, there was slight change, that the coalition that supported the president's not a monolith, and we're seeing that as time goes through, that we should focus on engagement, that all of us who care about change and moving change in our communities should focus not on who to blame, but focus on who to engage. The other thing, and this to me is the most important thing, is people get concerned because a lot of times the people who support the policies we're trying to move aren't popular, but the work we're doing crosses lines and is popular. Work on affordable housing community that desperately needs it. And it's immensely popular in that community across political lines. Opioid addiction affects everybody. Addiction knows no party. Working on it is popular. And I saw a lot of groups starting to be defensive about their work in this environment, whether it was food security or childcare or affordable housing, or in this case, addiction. And the reality is that this work remains incredibly important. And if you look even at polling in communities and in states, the things that people highlight are important are the issues we're working on. So don't feel defensive about the work you do. Another that I strongly believe is don't surrender, but navigate the diversity, equity, and inclusion argument. groups that have federal funding or work with groups that do have certain restrictions and requirements that they have as results of that. And we understand that groups have to navigate that. But the reality is, if I use my example of my community in Milwaukee, if we disaggregate the data on any issue, there are clear disparities that, correcting for everything else, involve race, gender, and other issues. And if we don't target work appropriately, we're not going to move the needle. And the only way we can understand how to move change in diverse communities is to have diversity within our coalitions. And so for us, the work continues. We may have to navigate that within this environment, but to surrender that completely is to surrender moving the needles we care about. The sixth, which I'm going to talk about in a moment, I'm going to just briefly say, is that groups and coalitions have to think about, who do we have to protect? What will we resist as a coalition? What do we need to be building right now? And who can we be bridging with? And I'm going to talk more about that in a moment. The seventh one I got wrong, which is, I spent 30 years doing policy. I worked for the White House for a period. I said, I represented a White House negotiating with Congress. And I'll tell you, the appropriators, even in our own party, were like, we control the purse strings. Don't tell us what but we tell you what the spending is. I spent 30 years learning that Congress controls the money. That one I got wrong. I have a client in Maine. I'm like, well, Susan Collins chairs appropriations. You just got to go show her the impact in your state. I had no idea that Congress would lay down and allow the president to change spending priorities the way that's happened. So I got that one wrong. Don't be afraid of advocacy. And this I share, every group has rules. And I know if you work for a university or you work for a public health department, there absolutely are. But for nonprofits, what we continually find is the nonprofits don't understand the rules and then give themselves restrictions they don't have because they believe nonprofits can't lobby. The reality is that 501c3 nonprofit organizations absolutely can. They can advocate completely and they can lobby up to a certain point, which is based on a budget. But to just give an example, a $500,000 nonprofit can spend $100,000 just on lobbying and be within the law. And lobbying doesn't include educating an elected official. It doesn't include building a relationship. It is only the time you spend asking them to vote on a piece of legislation. So if you do a bunch of meetings with a legislator educating them about addiction, you are not lobbying. And that doesn't even count towards that $100,000. And so just be aware of the rules, but we keep finding that nonprofits are under advocating. And it's because they don't know the rules and they don't do that. The ninth I'm going to talk about also in a moment, which is triaging strategy and work plans. Like, how do we adapt to what's happening now while maintaining and being a strategic organization or coalition? And finally, taking care of ourselves and each other. One of my clients is in East LA in Boyle Heights, which is a predominantly Latino community, predominantly immigrant community. They've had to shift strategy, but also in dealing with them and getting things done, it takes an enormous amount of empathy to recognize the stress and strain their entire community's under. And just being aware that for different people in different situations right now, in different states and communities, people are dealing with a lot of different things around this stuff. And being aware of that and just making sure we take care of each other and take care of ourselves in this space. As a mentor of mine said, when I talk more about protect, resist, build, if you live and resist 24/7, you will burn yourself out. We have to find ways to balance ourselves in this environment. So I talked about this protect, resist, build, bridge thing, and we created a tool. And these slides will be shared with you. And on the last one, I've got the links to all the things that are in here. But we worked with groups and have worked with a number of groups to just help them think about, okay, in this environment, what are the core values and principles we're going to continue holding as a coalition or organization? What is most important to us that we're going to continue to lead by and hold? Who in our community or in our network or among our employees do we need to protect? Are there people who face direct threat in the communities we serve, in the populations we're working with, that we need to be aware of and be conscious of threats they may face and how we can protect and support them? What specifically are we going to resist? Are there specific policies? Are there things affecting our specific issue that we need to resist? Are there things that as a coalition we want to resist? But being clear about what the line is. What are we going to do? We've had organizations where young employees want them to take on everything, and they're like, we can't. It's like be clear. This is what we're going to take on. As an organization, this is what we stand for, and this is what we're willing to stand up for. And make that clear. Think about what you need to build. We're in a period, not a permanence. I led a national nonprofit through 6 presidential administrations and saw seesaws in all sorts of ways. And I think right now we've got to think about what we build. The Bridgespan Group did a study 20 years ago about groups that had scaled major social changes, and they came up with this term, strategic opportunism, that all these groups had a strategy ready, but strategies don't often grow incrementally. It's when the right time comes and the right policy is available. You got to be ready. So what do we need to have ready if new policy becomes available to us? If there's a shift in politics that changes the opportunities that we have, what are we going to build that's ready? What can we demonstrate success on right now that's going to set the table for people? And finally, where can we build bridges? We're in a very divided time and community. And what we found in some of our communities is when people actually talk about these issues with folks and they get out of all the mess of the national stuff, they actually find they can build bridges and connections with people around some of the issues we're working on in communities. Because again, these issues cross lines. And so thinking about where we can build bridges and how we be more bridge building leaders, and it's not everyone's work. Some people, it's not their work to build bridges, and that's okay. But those of us who can and are able have to look for those opportunities and find spaces to bring people in and try to build more connection for the work we do and help people see things that are working. And especially those things that are working are so important to hold up right now. So that's that tool. And again, there's a link to it. There's a tool that groups can use and think through. The other tool I want to talk about is strategy triage. What this is a tool that just says, if I've got a strategy and we've got this kind of shock event that's happened in our culture that's changing things, instead of floating in and out of strategy, how do I make intentional choices about my strategy? What are we going to maintain as a priority right now? What's newly prioritized that wasn't on our agenda earlier, that because of current conditions we need to do? What are we going to pause? How long will we pause it, and when will we assess whether we continue and hit play again? But if we're taking on something new, what might we have to pause right now to do that? What are we not sure about, and what data would we need or conversations that would help us choose what category to put it in? Is there anything we just need to honor and let go and realize we're just not going to do? And so this is a tool you can use to assess your current strategy and kind of sort it out and make intentional choices about what you're prioritizing and what you might pause. This tool we created during COVID, and we worked with a lot of groups that had to pause work, right? But they were clear that we're going to, in 6 months, assess whether we continue this again and hit play. But what we saw was some groups were very intentional about what they did, and coming out of the pandemic, they were back on strategy. Other groups just slipped into other work and never made choices about it. And at the end, just kind of were a mess. And so this tool is really just an opportunity to really be choiceful in thinking about how we pursue our strategy in changing times. And the final thing I want to talk about here is just change management and recognizing that our partners and stakeholders are going to have to make changes and improve and stop doing things to align in this environment. And how do we manage people through change? And the ageless principles of change management are you signal early. You don't just throw on people. We worked with United Way that was changing their entire funding model. And they thought they were going to go to an event and announce it at an event. And we're like, what are you doing? You need to get people ready and start setting the table for this. You've got to signal early. You can't spring big change on people. You have to signal, we're in a planning process. We're looking at this and that. We're considering whether to signal things so people know that decisions are coming and change is coming, so it's not a shock. Communicate how and why decisions are made. I'm an executive coach, so I say, show the math. Walk them up your logic. What are you seeing? How did you interpret that? What data did you use? Who did you engage? Why do you think that choice is good? What are you willing to trade off for it? Just be really clear about how we got to that choice and decision instead of just falling in. The third is communicate with empathy. This was when I was in my leadership role. I would have some big exciting idea and I would share it with the staff. And I didn't understand why they weren't all as excited as I was. And my coach would say, well, Paul, because they're all thinking about all the things on their list to do. And your exciting idea is like 5 more things to that list. And they're all looking at it going, and you don't express at all like that they're going to have to change to do this. You just share that excitement without giving any sense of empathy for like stress they might have in hearing that there's a change coming. So just being aware that people have different levels of comfort with change and risk. And some of us as leaders are like excited to try something new and innovate and do something. And other people, that's a really risky, scary thing. And having empathy for that when we're sharing things. Acknowledging trade-offs and losses. When we do make choices, we often choose to do things. We also often choose not to do things. If we choose to prioritize something, we're often choosing to deprioritize something else. To name those things. We often gaslight people by not saying anything and trying to pretend it's all win-win when there are actual things that we're trading off. And naming those trade-offs is important so we are clear that we, in making this choice, we believe this choice is worth trading off or pausing, as we talked about with the triage tool or whatever we're doing, that we believe that's important, but we're naming it again rather than just letting it be. And that also goes to describing the change, explain how we're going to change, what's going to happen, and how we're going to move people through it. And give people bridges and on-ramps to do the work. So the last thing I wanted to share with you is just that I'm a recovering addict. And when I was working in the White House on policy, a number of people said, why did I come at this very differently than a lot of my peers did? And what I thought and realized is a lot of it came from my experience as a recovering addict. And that photo is me 10 years old with a jug of wine and a can of beer. And that's how my childhood started. What I thought was the first thing I learned was there were no silver bullets. And I'm sure all of you know this. There's no one method to get people clean and sober or to help people stay that way or to address it. There are things that work and there's some evidence around them. But I know from lots of people I work with, different things work with different people. And there were things that worked for me that wouldn't have worked for others, and there's things that worked for others that wouldn't have worked for me. And so when I looked at social change, and that was one of the things they recognized, I was always thinking about like you've got to have multiple avenues and ways because people are different and respond to different things. And that relationships matter most and mentors matter. That I found that relationships and peer relationships were one of the most important things. And mentorship really mattered. And as I entered my career, I sought mentors in my career as a young leader because I'd had that experience in recovery of seeking mentors. And that built a leadership skill in me that I found profoundly important. The third was owning mistakes and failures, which was part of my process, but as a leader, I found remarkably helpful. I wrote an article once called the 10 Worst Practices of Social Entrepreneurship, where I shared the 10 biggest mistakes I or my organization made in our first decade. And I learned that it was okay to make mistakes and to share the learning from them rather than being afraid of making mistakes. And that was something I learned. Welcoming and not judging other people's stories. In leading diverse organizations and networks, really being able to see and learn from different people. And practicing acceptance, forgiveness, and gratitude were things that I also learned that were helpful. And I share that just to say that in this space as a leader, there's a lot that we learn from this work that's really powerful. And for me, it really shaped my leadership to this day. And pay it forward. I started my organization because I had been helped by so many that I was trying to figure out how I could make a difference in the way that so many people have made a difference for me. And that's what led me into my career and led me to this work. And so I shared that. I wrote an article, and again, that article is linked on the last slide about this, but just, again, thought I'd share it with all of you just as an experience I've had of how I became a leader really came from the crucible of that recovery. And so want to take a few minutes just to see if there's any questions. We've got about 6 minutes, and just want to see if there's any questions or thoughts people have. This early morning time. Yeah. Yes, yes. So I sent them the PDF of the slides, and they'll be able to share those with everybody. Yeah. And that's why I put all the links on it, so that if you want to read any of this stuff, you can get it. Yeah.
If you could hang on just 1 second, we want to make sure we get you a mic. Coming to your left.
What advice do you have for young people stepping into leadership right now?
Mentors and relationships. So the thing I notice, so I led an organization, Public Allies, that was focused on building young leaders in communities across the country. And the big thing I noticed today versus when we started, there was no internet, which meant if I wanted to learn to do anything, I had to find somebody who knew how to do it and learn it from them. And what it meant that as young leaders, we built tons of relationships and mentor relationships with people who taught us how to do things, and we gained from their experience. And now I feel like young people Google something like, oh, this is how you do it. And we're not building relationships and mentorships. And I would say that as a leader, the thing that enabled me to succeed in the way I did was the number of people I engaged in mentoring relationships and peer relationships with through the work and learning from others. And I feel that's something that's been lost a bit in the age where all the information is available all the time. If we wanted to learn how to do anything, we literally how do you write a press release? We're like, who knows how to write a press release? We had to find some. There's no internet. We couldn't go to the Encyclopedia Britannica on how do you do a press release, right? We had to find people. And so I just think that one of the most important things is building relationships, finding mentors, and learning from others' experience. And again, enabling your own innovative ideas to come forward, but to contextualize them in the experience of others.
Back here, what advice do you have for more seasoned leaders who have had the ground shift under them and maybe some of their strategies aren't as effective anymore?
I think two things. One is use some of the things I talk about to look at your strategies and think about what's working and what's not. But I also think reconnect to the values that brought you into this work. I think one of the things that happens to us is we get in systems, and as we work in systems, we start to become more connected to the system rules and ways things work, and we sometimes get a little disconnected from what brought us into the work. And there's this awesome leader in Connecticut who created this program there where they work with people mid and late career leaders for a leadership program that just helps them reconnect and manifest the values that brought them into the work and bring that back in. Because after 20, 30 years of doing the work, you get ground down and you kind of lose connection to that. And so that's one thing. And I think the other is to just, again, really be open to shifting and thinking differently about the work and to test the assumptions we've always had. Because I think sometimes we get stuck in doing things the way they've always been done instead of opening ourselves. There's this famous story of a girl who asks her mother why she cooks a ham with the oven door open, and she says, that's how I learned to do it from my mother. And she goes to her grandmother and asks her why she does it, and she says, that's how I learned to do it from my mother. She goes to her great grandmother and says, why do you cook a ham with the oven door open? She said, because the oven's too small. And our organizations have a lot of open oven doors. Things we've done because it's always the way we've done things. And I think sometimes challenging that and questioning, are we doing things that actually make the most sense to move what we're trying to move? Are there other ways and different ways? So I think just opening ourselves to these things could be helpful.
And Paul, a little bit more of a reflection, because I really was struck by that statement about relationships matter more than programs. And certainly we can see that in the work that goes on with peer recovery work that we're doing here in terms of relationships and how important that is. But I think that applies to us as a consortium and the partnership work that we do, is that relationships are really key. They're really important. And how do we build those relationships, maintain them, trust, have the conversations, sometimes hard, but finding the ways to maintain those relationships seems really critical as the energy to move some things forward.
Absolutely. So my partner, most of my work, Dominique Samari, created this thing called Kin Universe, and she works specifically on diversity, equity, and inclusion work with groups. And what she found is actually by engaging people in 5 conversations in pairs with someone different than themselves, who they didn't know well, and they have 5 meetings and 5 conversations before they have the conversation about diversity, equity, and inclusion. And what she found is when people actually built trusting relationships first and then entered that work, they went deeper, further, faster. And her argument was, we've done this, in that example is that we've done work without building relationships first. And I would say the same thing with coalitions. When we do work building collective impacts, we as consultants, when we're working with groups, spend a lot of time on the relationship building side. And the groups are always a little bit like impatient with it. And we're like, if you don't do this work now, you're going to call us in 2 years and you're going to have a much bigger problem. And so I like to be timely, so I manage my time. And so I think that I do think relationships matter so much to this work and to all work. Coalitional work, the trust is the #1 thing. If you have a coalition where there's not a real sense that everyone belongs, everyone is trusted, and trust the process, that everyone feels included, that difference is honored. If we're in a space where that's not happening, the rest falls apart. Whatever the work is, I think relationships are the place to start. And I think so often we get around tables, we say name, rank, name, title, organization. And if your organization got the grant I was supposed to get, I now hate you. But if we actually got to know each other and found out our kids had gone to the same school and we finally say, now I kind of hate you less, right? And now I'm going to listen to you differently. But we so often get stuck in our mental about you work in this style. Oh, I don't like that organization, whatever. If we get to know each other as people, we work better together. So I think relationships always matter most. Thank you so much. It's an honor to be with all of you. Thank you for all the work you do.